So today what we're going to go over is an SPRT technique, a tab taping technique for the SI joint. We're going to put this application onto the SI joints in this instance. This is one of the techniques that we cover in the Total Taping course, and we're just going to cover it here today as well. So to know if this technique is appropriate for us with the individual patient that we have in front of us, we're going to do a pre-taping outcome measure. So we're going to see what impact it has before we tape. This is something that we really advocate through the course in that looking at a pre and post taping measure so that we can ensure that our application has actually had the positive clinical effect that we're looking for. So what we're going to use in this instance is kind of an adapted ASLR to find out if it's appropriate. So this is absolutely great for your acute SI joints, your really painful, twingy, spasmy ones that patients that are coming in are really struggling and really in a lot of pain. This technique is absolutely brilliant. So what we're going to do, let's assume that we've got a patient that is painful on march or gilet testing. So if I can just get you marching on the spot for me, if that's okay. And let's say that when they weight bear on that side, they get a sharp, twingy, reproducing their symptom pain. If that's the case, we'll say just relax in that position. And what we're going to do is come lateral to the PSISs on either side, and we're going to apply a force quite superficially on the fascia from lateral to medial on both sides. So we're going to do this here, and then we're going to have them do the marching on the spot. And what we want to know is, does that feel worse, better, or no difference? And relax. If that feels better, that's a positive outcome for us knowing that the tape is appropriate and should help clinically. We can use marching on the spot. Likewise, we could use a lateral flexion test if that reproduced their pain or their symptoms, or we could use flexion or extension. So we could ask them to lean forwards and test if that was painful. Likewise, we could just reapply that compression from lateral to medial both sides, and again ask them to pop into flexion and or into extension. And again, if that pressure either side reduces the symptoms that the patient is experiencing, that's a positive indication that this taping application should help. So if that is what we are happy with, what we're going to do is start our taping application. Now the first thing that we're going to do is use some kinesiology tape. Now I'm going to use kinesiology taping for this. You don't have to, you can use a hyperfix application. Really this layer is just to protect the skin. So I'm going to fold it in half so I know that I've got the sensor. And what I want to do is actually tape right over the SI joints. I want to make sure that I'm covering the area that was helped by my compression in here when we did the test. I'm going to put a little bit of a stretch on here. Again, you don't have to, because it's going to be completely superseded by the rigid tape that we're going to use over the area. And we're just going to take either edge off at tape off tension. So with that being applied, what we're going to do is use some rigid tape. Now I've just got some zinc oxide strapping here, and we're going to create a little tab. So what we do is take a section of tape off, and what we need to do is create a little reverse fold in the middle of that section of tape. So the key is that you want this tab to be about the width of your thumb, yeah, because you need to be able to get your thumb out from underneath it essentially once you've applied it on. The rest of the tape, because this tape is nice to handle, we can hold on to the back of it, and what we want to do is pop this on again, just lateral to the PSIS. So we can come lateral to the PSIS here. That's great, and we're going to take a second strip of our zinc oxide tape, and what we're going to do here is make sure that you've got a nice secure hold to fix this on well, and then attach it to the tab. So we want this strip that's overlaying the top to catch the tab underneath. Now this is the part that does the job. What I'm doing here is with my thumb underneath, I'm pulling the skin just to drag on the skin and the superficial fascia from medial to lateral. At the same time, I'm pulling this tape from lateral to medial. So we're going to bring this across and we're going to lay the strip down. Now this is what we want to see, this really lovely skin fold in here. And that is when we know that our tab taping has done the right thing. We are going to do exactly the same on the opposite side. And we've got a little tab that we've created again here. We're again going to come just lateral to the PSIS, pop our second tab on, and then this strip I'm going to put right across so that we can secure everything down nice and neatly. Now, again, make sure that this holds nicely. And then what we want to do is get our thumb underneath. Again, I'm pulling medial to lateral as well as lateral to medial. Attach down immediately so that you've got that nice fold underneath, and then the rest of your tape strip can just come straight across. It is really important to secure down the edges, but this taping is absolutely fantastic, and there's a number of different techniques that we go over for using this. We use it on the ATFL for inversion sprains. We use it on discs. It's brilliant for reducing disc pain. Seen some absolutely fabulous results with that. Use it on acute hamstring tears. There's a number of different uses, but it is a great technique for acute pain. It is phenomenal, the difference that it makes. So a really excellent clinical technique. And when you've got someone with an acute SI joint issue, this is absolutely brilliant for relieving their symptoms. So this is what it looks like in the end. And then of course what we're going to do at the end is retest that initial movement that aggravated it. So if we do that marching on the spot again, what we want is for them to feel the improvement that we had with our manual compression with the taping application, so that they can go away feeling a lot more comfortable after treatment. Okay, so that's just one of the techniques that we cover. Hope you found that useful. For lots more, then join us on one of our taping courses. Thanks.